knows how to work everything. So HP mode, so we're gonna do the smart refresh procedure. So we're gonna start with 5 watts and see if it's something that she can tolerate. And the other thing that I do is I already have an estimated setting in regards to what I'm going to do for her treatment. And I write those down so I know exactly where I'm going to start in regards to my parameters. Okay? That way I'm not struggling. And then I can always change variations from there. And what I do in this instance is I pick other patients that have similar complexion to her, that I've seen the results from my treatments on them, and that's kind of how I determine my starting point. So the more patients you treat over time, if you document well, you have photos of those patients, you can see the results that you've achieved, you can then tweak your settings, and that's how you build up your protocols in regards to moving forward. So the emission mode's HP. Remember, this has no dwell time. All right, so I'm at 5 watts, 1100 spacing, and then I'm going to check this. Am I in view, Tracy, with my cotton tip outlet or with my stick? Okay. So I have my system's got suction here, and I just like to test this and make certain that I'm happy with the settings and everything is functioning appropriately. So this is a hexagon pattern. Okay. All right, Mary, we're going to go ahead and get started here, okay? So I'm going to do a little spot check on you and make sure that you're comfortable first before we go to town, okay? And what I like to do with my patients, we're going to put some protective eye gear on because I'm not going to hold gauze over her eyes. What I find works better. I'm going to put a little gauze on her eyes like this. Because these little things, once you put them on, slide this over her eyes like this. That way they're not digging into her eyes. Lift up your head for me, off the chair. Keep it up for a moment. She has a big hair bun here, so I'm going to work with it there. Have to tighten it up in the back. Okay, very good. You rest your head back. So that way it's not too tight, but I find that the gauze provides some protection and it's more comfortable. I'm going to have her lift her chin. I have you turn your head to the right for me. I'm going to focus here on the inferior border of her jaw. I'm going to start there. And what I like to do is I like to actually put my hand here at the inferior border, so that way it creates some contour, okay? And then I'm able to take my laser, and I'm able to rest my laser right on my hand. And then that's how I'm going to follow the inferior border, okay? The other thing, on my marking pencil in here, so you give me a marking pencil, please. The other thing that I will do, just to keep me in line of where we're going to treat her, is I use a marking pencil. This is white, so I'm able to actually draw on the patient. So just so that I know exactly where I'm going to stop, because once I remove my hand. So here's the inferior border. I'm going to lay my pencil just like this, just down like this, a white line, okay? Up to the earlobe. So turn your head to the left, the other way for me. I'll do the same thing over here, just so I have some guideline of where I'm going to stop, okay? So I'm going to come here like so. And this is just a guide point. Put your head center for me again, perfect. And then we're just going to connect these 2 points here. Okay? And I found if I laser over that, it doesn't interfere with anything. Head to the right for me. But see, that way I know where I'm going to stop. Hairline's where we're going to stop everywhere else. So, check my laser again because I stepped away from it for a moment. Perfect. Okay. I'm going to stay away from these big fancy earrings she has so we don't blind anybody. Everybody in the OR's got lights on here, or goggles on. Perfect. So, and then you get yourself in a position to where you can actually see exactly where you are, all right? I'm going to do a little test spot here, okay, Neri? Let me know how you do. How was that?
It's fine.
Feel anything?
No.
Okay, perfect. It's always good to check with them to make certain that they're comfortable. And I like to do, so this was my first pass. My second pass, I kind of like to overlap, usually about 20-30%. So, and then I just start going here. And I like to move my hand as I'm doing this, so that way I can see exactly where I'm at. And I just kind of pick a parameter. So I've done the whole inferior border here now. And I usually stop just at the chin point here, all right, on one side. And then we're going to kind of come back and do the same thing. And then once I do this, create a little overlap. Now just so you know, the laser has the ability to where if you step on the foot pedal, it will do what's called a repeat pulse, okay? And you just keep your foot down. I like to use my foot, and every time I step on the foot, over the years I've gotten used to step, 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 and I can actually be a little faster than the actual settings in the system. So that's just my preference. So my ankles are very well developed. I'm like a kangaroo. Now this is 5 watts. Now I'm going to create a little tension here so that way it slides faster. I'm just kind of sliding from one to the next. Traction on the ear. How you doing so far?
Good.
Feeling anything?
No.
Perfect. Okay. So you can see where we're resurfacing. You're going to start to see some erythema start to kind of pop up as we go along. The view in the camera still good for everybody? Now here in the operating room, you can start to kind of smell from the heat and the ablation of the tissues. So it's always good to have a little tension on the skin. So I'm just pulling here a little bit. That way it keeps the tissues taut. So I can actually move and advance from one area to the other. And as I told you earlier in my lecture, I utilize my team. Okay, my assistant here has a very shrewd eye. And she's paying attention to where I'm resurfacing as well, because she's looking to make sure the hair's out of the way, the elastic strap from the goggles, and she's making sure that my overlap looks to be consistent. You train them to do that because it's very easy, especially when you're teaching a course and you're talking, to kind of overlook a specific area. And the goal here is that sometimes these white dots from the dots are so fine, it's hard to see where you're resurfacing. So it's good to kind of maintain a consistent pattern. Over the course of treatment, the inflammation will start to become more noticeable, and then you'll be able to see exactly where you resurface. So once again, overlap with this technique with fractionated resurfacing. There's no harm unless you're doing multiple overlaps. So I basically stopped at the chin point, commissure mouth, nasolabial fold, and I do it in segments. So I'm going to go actually just to where my gauze is, and then we'll come back and do the eye afterwards, okay? I'm going to go right up to the corner of the nose. How's my patient doing? Good, okay. So the segment that I've treated thus far is here, to my elastic, okay, underneath my, so that section's done. Try to work in segments, you'll be able to maintain consistency. Turn your head straight for me, okay? So I'm actually gonna turn your head all the way over, yep, perfect, just like so. Now we're gonna go to the opposite side. I do the mouth after, because then I can kind of blend things together. So I'm gonna put my hand down here again. And sometimes you have to move the laser because the articulating arm is rigid and it only has so much flexibility here. So same thing here. Put my hand down here so I can feel the inferior border. So if we were doing traditional resurfacing, I would not be moving this quickly because I can't overlap. You don't want to overlap your passes. With this, having some overlap does not cause a hindrance in your outcome. Before I initiate each pulse and fire, I try to make sure that the laser prongs are sitting up against the tissue, okay? So I press, zap, move, press, zap, move, press, zap. So that way everything kind of makes certain. The purpose of these prongs here is when you push on the tissue, it causes the tissue in between here to lift up. So it brings the tissue closer so that way everything is flat. So that way you get an even resurfacing. If I held it here or I was on an angle, the energy is still going to be absorbed, but it's not going to be consistent. So the fluence is going to be off. Now, this is not a procedure that just happens automatically quickly. This takes time to do this. You have to have patience. And as an oral maxillofacial surgeon, I don't have the patience of a dermatologist. So, but I've learned to adapt to implement these procedures in my career. Yuri, how you doing?
Good.
Feeling any of it? I'm sorry?
Not really, no.
Not really. That means she feels it a little.
You like
It's
the
fine, it's all right.
not that you like the octagon, the hexagon over the square for the overlap.
Those are my two favorite. I've gotten more comfortable with the hexagon pattern because I can kind of see exactly where things are when it comes to overlapping because I line the edges up. The square to me, I don't have as much flexibility around anatomy, like the nose, around the eye. I think it's what feels comfortable in your hands.
Yes.
But now that I have teenagers, it's very common for them to tell me to stop. So this symbol here, this design pattern, just makes me think of my children all day. That was a dad joke. And they would say, that's not funny.
Yeah.
It's not, obviously, but. Counter retraction. And what's happening now is I can actually, from my hand, I can actually start to feel heat coming off of her face. Put your head straight for me. Perfect. So, and as the heat starts to build up, it tends to become a little bit more uncomfortable. So now we're back to the chin, the midline. One thing I tend to do around the lips, it's not uncommon for me to take the lip and actually create a little tension. My assistant's going to pull down, I'm going to pull this way, and I like to put it right at the line that's demarcated. And that way if I roll upward, I'm not getting on the lip, it's going on to my cotton tip, my tongue blade, okay? And I would say miss this area here, so we're going to change this. That way I stop, you can see I stop just at the lip. It's a good way, it's easier to protect the tissue, you know, change your pattern so that way the tongue blade protects it, okay? Instead of trying to stop and sculpt it. It's not the end of the world when you're doing this, but if you're doing traditional resurfacing, you see how we just stopped and we got good symmetry on the lip. Got a little trick that I have there. I'm going to do the same thing for this one here.
So what if we hit the commissure lip?
What would happen to it?
Yeah.
Nothing.
Nothing.
Yeah. Not with these type of settings, but just teaching a little trick so if you get more aggressive around the mouth, you like to give all my little pearls. Now, many of you may do these with sedation, and you may use oxygen. You need to turn the oxygen off when you're working around because oxygen's flammable. I've been pretty cavalier in my career. I've been fortunate, so I'll leave the nasal cannula as I'm treating the peripheral of the face. But when I get around the mouth or the nose where the cannula is going in, I'll actually turn the oxygen off or take it off the patient altogether temporarily, and then put it back on to make sure that they maintain their saturation. So I'm going to treat the bottom part of the nose now. So what I'm going to do now, if you look here, is the tongue blade in the picture?
Yes.
Okay, so I'm going to change the size. Look, I can shrink that. See how my spot size has changed?
Yeah.
You're doing that with just the...
Yeah, so the yellow button changes the spot size. So I've decreased the spot size because I'm going to get into areas that are a little bit, a little tighter. The other thing that I have the ability to do, all right, is I can obviously change the actual pattern with the red button. Okay. And then with whatever the pattern is, that's the red button I've changed. Now the green button changes the shape of the pattern. See how it kind of makes it more narrow? I don't ever use this one. The green button, even though green means go, it's something that I never use. So I just put it back to its natural shape. I'm going to change the spot size here, okay? So working around the nose and the nostrils, I'm going to lift up on the nose. And we'd like to make sure that they're numb here too. And this now though, it's going to be faster because the spot size is smaller, so you'll see how much quicker it is.
So you don't need to change the power for the smaller size.
Repeat that.
You don't need to change the power for the smaller size.
You can change the power, but no, I want the same power settings that I've used everywhere else.
Oh,
Okay.
okay.
And I'm pretty detailed. I like to do the full nostril, the full, the columella that's here. I like to get into the nasal creases. I mean, who wants just a partial resurfacing? So I like to get all those areas. I find that the results are obviously much better that way. But it's that detail that gives us results that are much better. You can see it looks like it's snowed everywhere evenly on her nose. So it's those little details, and now I'll go right on the inside of the internal part of the alar rim, so that way it's symmetrical. You can leave those areas, but I find that it looks better and heals better, okay? So I'm gonna save her eyes to the end. We're gonna move up to the forehead now, same settings, okay? We're still at 5 watts, 1100 spacing. I'm gonna open up my spot size to the largest size. I'm gonna have you turn your head a little to the right for me. And I'm going to pull this elastic, Alina, hold the elastic down on this side. Just going to hold that down a little bit so that way I can kind of go right up to the eyebrow. See how much longer it takes because the spot size is bigger? You can use the smaller spot size, but obviously it takes longer, okay? Now, same thing here with the eyebrow. Put my stick. See how I stopped just short. I tried to do this with when I first started, I thought I could do it with this thing, but then you got to overlap. So the tongue blade obviously works much better. Helps hold the hair down as well. Put your head straight for me. Thank you so much. You still doing okay?
Yep.
Okay. I think it's good to ask your patients how they're doing, even if they're doing a course and they lie to you. We just want to make sure they're doing well. Turn your head to the left for me. my assistant just pointed out to me that I skipped a little area there. And that's why we have a team with much younger eyes. You see I was much slower here because I didn't put the stick there. And that way I can see where I'm at. So I'm resurfacing over the area that I did those little localized ablations. My assistant's going to take this, let's go back a little bit more here. So I've treated the full face, head straight for me again. The full face, forehead. The only areas that I haven't treated is around her eyes. So I'm going to change up things a little bit. I'm going to take off this little head eye gear here. Lift up your head slightly for me. Okay. I'm going to take these off, wipe it off for me, nice, gentle. Turn your head this way. The area that tends to be the most sensitive for my patient is actually the eyelids, because the topical is hard to put on because it drips into your eyes. So let's do this. My assistant's going to pull down on her facial tissues like this to pull her cheek down. And I pull down for me. And I'm going to just take her eyelashes and just kind of lift up slightly. Just remove this. And now I got things protected. There's a little pressure there. I'm not pushing down on the globe to create discomfort, just to kind of protect the eye. I'm going to keep my fingers here as I resurface. Be a little sensitive, bear with me. See how she twitched a little bit. We only have a few spots to go. You felt those ones a little bit?
Yeah.
Okay. Tolerable?
Yeah.
Okay. That means no. So, it's okay. So let me go quickly. What you can do is change the spot size so it's smaller, and then there's less heat in that actual pass of it. So I want to do the upper eyelids. It's going to be a little more sensitive for her, but I'd like to try to at least get them. So Alina's going to protect the eye. A little pressure here, okay? Bear with me. Let's start up here by the brow. I'd like to at least get one pass for you. Bear with me there. Okay so far?
Yeah, that's fine.
Okay. Let me know if you can't tolerate it, okay? She's a little more numb up towards the eyebrow than she is towards the eyelid. I'm going right on my gauze here. It's wet. I'm going right into the medial canthal region around the nose. Okay? Come off. So you can see we went almost all the way down around the eye. I missed this area right here in this corner. I'm going to cover her eye. A little pressure. Perfect. So we've completely resurfaced around the eye, about probably 4 millimeters from the actual lashes. Okay? I'm going to have you turn your head to the left for me. We're going to do the same thing around this side here. Let's do the bottom first. My assistant's going to pull down on her cheek. Perfect. I'm just going to cover up her eyelashes and lift them up so I can see the crease. This is a smaller spot size, so it'll go a little faster, a little pressure. I stop in between each pulse just to make sure she doesn't move or twitch. But the smaller spot size is easier to tolerate than a bigger one because it goes faster. A little trick. Okay. The same thing. I'm going to pull up on her brow, and my assistant's just going to gently put some pressure there. I'm going to start close to the brow. You don't have to include this into your treatment plan. I just find that from a comprehensive approach, patients get the results that are much better. I'm going to get closer to the eye now. making sure I cover all areas. So do this. Make sure we have the corner of the eye done here in this corner. Perfect. And then we do the inside corner. Put my finger here to protect her eye. Rather zap my finger. Head straight for me again. Wet gauze. Just gonna put a wet gauze here. Now we're gonna finish the nose. We're just about finished. We're gonna go over a few little areas because she wanted me to be a little more aggressive around the mouth. Yeah. Tracy, can you draw, please? I'm doing a kind of a second pass over the nose here. Up into the glabella. I missed that area. I'm going to go around her mouth again when we discussed her treatment, and then I need to do a blending pass to her neck. So lift your chin up high for me. Let's do that first. So you can see where my white line is here. All right. I used to wipe this off, but I've gotten more cavalier. It just it doesn't get penetrated into the tissues, but I'm just going to kind of overlap slightly. So from an overlapping pass, right now she's on 5 watts. 1100 is her spacing. I'm going to drop her on. We're drawing blood for her PRF right now. I'm going to take the spacing, and I'm going to open up the spacing to 1300, and I'm going to drop the wattage down to 4. So Tracy, I've got 4 watts, 1300, okay? And that's going to be her blending pass in her neck. Turn your head to the right for me. Perfect. So that line is kind of like my guide point. I'm going to cross the fence. I'm going to cross the white line slightly. I'm going to start up here because I can see where I've resurfaced up to it. You can see a little of the erythema, a little of the swelling that's there. I'm just going to follow this. Kind of split the difference. Okay, so I've done 1 pass there. I'm going to do just, now I'm going to line it up with the fence or the white line. Go a little further. A little overlap. So I extend that out. This is minimal, but it will just create a better effect in regards to the blending. Put your head straight for me and turn to the left for me. Very good. The benefits of having a patient awake is I can actually ask them to do something. When they're sedated, I have to take the volition to move them. Okay? So you can see where my white line is here, where I stopped is actually about 1 centimeter higher. So I'm going to pretend my white line's a little higher here. I'm going to follow my markings first. Remember, it's a guideline. It's like using a surgical guide for implant surgery. It's a guide. It's not an absolute. Put your head straight for me. So what I'm going to do quickly here is just kind of look from a different view because I want to make sure things are even. So I need to come down just like this. I'm going to put my hand here so I can blend things in. Lift your chin up super high for me. Thank you. Just for a moment. I'm going to stand out of my chair. And I'm just going to blend these guys in here. A little overlapping in the chin region. Okay? So it's going to look nice and even around and even. Right? So that way it blends under it. You won't see much from this, but that blending will help kind of feather things in very nicely. Now, she wanted me to be a little bit more aggressive around the mouth, so even though this is a smart refresh procedure, I'm going to actually do a secondary pass. So I'm going to put back up to 5 watts, The spacing was at 1100. We're going to do pass number 2, peri-oral. What's that beeping noise? Out there? Okay, energy is set. Okay, so basically I'm going to kind of just go like a big circle, all right? Start here at the inferior border. Go about 2 centimeters from the commissure. I go right up to the nose. I don't necessarily have to get back up to the lip again because we've already done that for a secondary pass. You just kind of follow up to the nasolabial fold, up to the nasal crease. And if you're able to see, you'll start to see that her face is starting to create a little bit of oozing in these areas, and that's just the response from the laser. You'll start to see a little serum from her body, in a sense, part of the healing process, and the response from the injury of the tissue. So that was a second pass in the parietal region. Okay? Turn your head to the right for me. What I am going to do for her is do another second pass in these areas of pigmentation around her eyes here as well. How are you doing, okay?
Okay.
Tolerable? I just got a couple more little passes here I want to do for you, okay?
Okay.
Because in that way that skin will exfoliate and these areas will come off quicker. Kind of like little spot treatments over these darker areas, like freckles. And I'm talking out loud, and I do this when I'm doing the surgery so my assistants can take detailed notes, and then my notes will reflect exactly what I did. Turn the other way for me. Perfect. This is the same way I do spot treatments when I have patients that have like acne scarring. I go back over those areas multiple times. And there's a setting that I use on a rare occasion called stacking pulses. And that's a setting that's actually in the laser. I don't do it on most of my patients that are darker complected. I don't want to go that deep. This is more of a superficial peel. Put your head straight for me. Hold one from here up. Okay. So I've completed her treatment. What I've done now is I've taken sterile water, all right, and I put it in a freezer, and then I put it into a sterile pan and a dish, and I take surgical towels, and I soak them. This is going to be cold, okay, Neri? It's going to be cold on your face, and this is actually pretty frigid. All right, it's not like the South Florida waters. All right, I'm going to cover your face here, and I go just over the eyes into the nose. I hold a little pressure. What this is doing is it's extracting the heat from the internal tissues. And you'll feel that in the course of a minute or two, these things get warm. Now, if you like your patient, when you put this on, you go below the nose. If you don't like your patient, you cover them up completely. And since we like her, we're going to do this. Same thing. You have to be able to breathe. Just some compression here. Now my assistant's in the back. She's drawing off the extract of the actual serum from the PRF. These are the white tubes. This is not the...
I know, but still, it'll start clouding.
It will. That's why you have to do it fast.
Okay, yeah.
Yeah, the white tubes don't clot really. The red tubes do.
Right.
So when we add that to our bones, I just took the extract from the white tubes when I do these procedures, but I have had a clot. I try to push it through and then it gets stuck and I gotta pull the clots out of it. Doing okay? Does that feel good?
Yeah.
Good. Ready? Got a good resurface here. Now this is the PRF. We're just going to squirt this on the face and I rub this in. Try not to get it in our eyes. Okay?
Buffy coat.
Buffy coat.
Yeah.
And once I've done this, we will then put some Aquaphor on our face. I find this to be very soothing to the skin. I've had the procedure done myself. Everything that I've done in the practice, other than my 4-dimensional facelift, any surgical things, if I could operate on myself, I probably would. However, we had one of our, let me wipe my hand. We've had one of our course attendees that's a dentist that uses the DECA. She said she was going to resurface herself, her face, and do these procedures on herself. And she actually did. I advise against that.
Yeah.
But she stood in a mirror and she resurfaced her face. That's against the guidelines from the course.
See somebody on YouTube extracted their own tooth and put in their own implant in it too.
Oh wow.
You know, when I was in dental school, we had a pediatric dentist that taught us in school, and he actually did a class 5, or I don't even know what the classes are now, but he replaced a filling, a composite filling on one of his anterior teeth. We didn't have cameras back then to record everything, so whether it was true or not, but and I picked on him. I said, well, no wonder the margins are off and the shape doesn't look good. You did excellent. You were a great patient today. You made me look like I know what I'm doing. Thank you.
So does it feel just like a sunburn?
Yeah, a little bit, yeah. But it's actually not bad. But it would be more painful.
Lift your chin up for me. Take a little of this white line off with this wet towel, okay? Sometimes I leave markings on just so the patients know I did something to them. It's like a little signature. So my assistant's now taking some Aquaphor and she's just rubbing it onto the face, very thin layer. And then what I'll do is once she's done, I will take photos on her. I like to document, even after surgery, of how patients look when they leave my practice.
So this has antibiotic.
Nope, this is just like Vaseline, Aquaphor, no antibiotics in this. And I don't use antibiotic ointment like Vacitrace or anything for these types of procedures. Just simple Aquaphor. It's worked well. It's economical for the